Hello, I'm Dr. Lindsay Crawford. I'm a pediatric orthopedic surgeon with the UT Physicians Orthopedics Department. I'm going to talk to you this evening about growth plate considerations in the young athlete. Objectives this evening of this talk will be to talk about what is a growth plate and how is it injured. I will review some specific growth plate conditions that are common in young athletes. We'll also talk about how to treat and prevent growth plate injuries. First off, during this time, after a rest period with COVID, as kids are getting back to sport, I did just want to emphasize a few general important rules for return to play. Number 1, warm up and cool down prior to practice or play and after activities is key to help prevent injury. Use stretching during this time. Stretching involves going just beyond the point of resistance and holding it for 10 to 15 seconds. Also, especially in this Texas heat, stay hydrated. It's important that your child not wait until they're thirsty to drink water. Water and non-sugar-filled sports drinks are preferable for hydration. Also, children should avoid playing when sick, in pain, or overly tired. Teaching your young athlete not to overtrain or play through the pain is important. So, let's talk about why children are different than adult athletes. So one particular difference we're going to focus on today is the growth plate. This is called the physis or apophysis if it's attached to a tendon. This area is where children gain bone length and get their height as they grow. Most of the long bones, which would be the thigh bone, leg bone, and forearm, have 2 growth plates, one at the top and one at the bottom. Other areas, such as the elbow pictured here, have more than just 2 growth plates. So the growth plate area is made of cartilage, so it is not calcified like bone. So it is weaker than bone, ligaments, and tendons, and this is why it's an area that can be prone to injury and overuse. Injuries that can produce a sprain or a strain in an adult can produce a fracture through the growth plate in a child. These areas are also prone to overuse injury. This is because overuse stress reaction leads to irregularity and widening at the growth plate because of inflammation in the area. If that repetitive stress continues, then the growth plate can become permanently damaged, may actually stop growing prematurely, or it may fracture. So I'm going to go through a few conditions specific to growth plates in the young athlete. First, we'll talk about little leaguers, shoulder, and elbow. So throwing athletes, this includes all throwing activities, including quarterbacks in football, and we'll talk a lot about pitchers in baseball, but this includes the other baseball players as well. They are at high risk for overuse injuries of the shoulder and elbow. So little leaguer shoulder involves an injury at the growth plate in the upper arm bone near the shoulder at the top of this humerus bone. Whereas little leaguer's elbow involves injury to the growth plate in the bottom part of this humerus bone near the elbow on the inside. Little leaguer's shoulder, pictured here in x-rays, is again common in our young throwing athletes. It's because they're applying forces across this upper arm bone in their shoulders during the overhand throwing. So the growth plate in that upper humerus can appear widened and on an x-ray, and the patient will be complaining of pain in this area of the shoulder with throwing. This pain is often better with rest and worse with the throwing activities. Little leaguer's elbow, on the other hand, is this inside bump on the inside of the arm. That's the medial epicondyle, and this is a growth center that has ligaments and tendons attached to it. Again, repetitive throwing stresses these ligaments and tendons, and it can weaken the area. And again, in these x-rays, you can see that the growth plate can appear widened and irregular. These patients will complain of pain on the inner portion of their elbow, again, with throwing activities, better with rest, and sometimes will have tenderness when that bump is touched. So for both our little leaguer's shoulder and elbow, after evaluation, including x-rays, we're going to recommend rest from throwing. It's the key to treatment for these. And this needs to be long enough to reduce the inflammation in the growth plate and allow it to return to its normal anatomy. You can use ice and anti-inflammatories to reduce the inflammation to treat the symptoms, but rest is what's going to truly get that growth plate feeling better. Pushing through the pain can only make the injury worse and may even lead to a fracture or further damage to the growth plate. If a fracture occurs, it's a possibility that they may need surgery. After the period of rest and growth plate recovery, we will put them through a gradual return to throw program. Once they return through the return to throw program, it'll be important for them to pay attention to 3 things in particular. Pitching technique. Often it's recommended for them to work with a pitching coach on technique. Pitch count. And you can see here on this chart, there's formal recommendations based on age for how many pitches they should be throwing per game, and also the type of pitches. Depending again on the patient's age, there's recommendations for the type of pitches they should be throwing. The USA Baseball Medical and Safety Advisory Committee does provide information on both number and type of pitches based on age. Moving on, we'll talk about the gymnast wrist. So the gymnast wrist is irritation and inflammation at the growth plate of the distal radius, which is the bone on the thumb side of the wrist. Gymnasts use their arm in weight bearing when they do tumbling and vaulting activities, so the wrist sees loads that are not typical for it to see, and it's used as a weight bearing extremity. It's because of this that the growth plate can become inflamed. It often appears in a period of increased intensity of gymnastic activity, oftentimes when the gymnast moves to a higher competitive level. These patients will have symptoms which include wrist pain, particularly with impact activities, swelling, and reduced range of motion of the wrist. Similar to our little leaguers patients, they will be able to be treated with ice and anti-inflammatory medications to reduce the inflammation, as well as rest from impact activities. Sometimes they need to be immobilized in a cast or brace to help with this period of rest. And it needs to be long enough again to reduce the inflammation at the growth plate and allow it return to normal. Just the same as with our little leaguers, pushing through the pain will only make the injury worse and can potentially increase the damage to the physis, causing it to close early. I'm now going to move down to the lower extremity. We're going to start at the hip. Next, I'm going to talk about slipped capital femoral epiphysis. I know it's a mouthful, so we call it SCFE for short. So this is a condition at the child's hip where the ball part starts to slide off of the thigh bone. It's kind of like an ice cream falling off of the cone. And so this occurs through the area of the growth plate at the hip joint. This can happen slowly over time, or it can happen immediately from a trauma. We usually see this in the early teenage years, and oftentimes in an obese or overweight patient. These patients will complain of pain in the groin or hip area, but sometimes they'll complain of pain in their thigh and knee. And then these patients at times can have limping or pain with walking. Sometimes you may note them walking with their leg turned outwards. Sometimes I see patients come in that are football players that have just returned to play. And so this is mistaken as potentially a muscle sprain or strain or just overuse. But with the persistent pain and limping, it's always important to get this evaluated. The reason why this is so important to get evaluated is this is a condition that would need surgery. So an urgent referral to clinic or even visiting the emergency room if your son or daughter is unable to put weight on that leg. The reason why this is so important is because a screw is placed across that hip growth plate to keep it from slipping any further. And this is to help try to prevent any permanent damage from the hip joint. Next, I'm going to talk about Osgood-Schlatter's disease, which is a very common cause of knee pain in children. So Osgood-Schlatter's occurs at the tibial tubercle, which is that bump that we feel at the top of our shin bone where the patellar tendon attaches. So with activity, the pain comes from the pulling of the tendon on that growth plate. And over time, they can develop pain as well as swelling at this location. So again, the treatment will be similar to our other growth plate overuse injuries, which is rest from activity until pain is improved, icing, and anti-inflammatories for the inflammation. We also recommend stretching and strengthening, particularly of the quadriceps muscle for these patients. Sometimes these patients will get relief with knee sleeves or patellar tendon straps that they use with activity. The good news is, as this growth plate close, which is usually around the age of 14 for girls and 16 for boys, this problem does get better and goes away. Finally, we're going to talk about Sever's disease. We're moving down to the foot now. And so this is the growth plate that's in the calcaneus, or the heel bone. And this is, again, a repetitive stress injury in the heel. And so oftentimes we see this in patients that are in running activities, particularly sports in which they wear cleats. So again, these patients are going to present with pain in the area of the heel and the Achilles tendon, potential swelling along with that, worse with activity and better with rest. For this, treatment will be heel pads or heel cushions, particularly used in their athletic shoes and cleats. They can wear shoes with a slightly elevated or extra cushioning in the heel. Also, stretching exercises are important as the Achilles tendon attaches to this area, so particularly stretching the calf and the Achilles will reduce stress on the heel. Again, they can use ice and anti-inflammatories as needed for pain and swelling. So, when should you be concerned when your young athlete is out there and complaining of pain? It's important for coaches and parents to be aware of the common signs of these overuse injuries that affect the growth plates in children. So, pain. So again, the pain often increases with activity and it's better with rest. Sometimes it's easy to overlook this since they do feel better when they rest, but if consistently when they return to play, they're having pain, it's important to get this evaluated. You may also note swelling associated with that pain. And you may notice the athlete has a change in their form or technique. Sometimes kids don't want to complain of pain because they want to keep playing, but you start to notice that they may be limping or not throwing as well as they used to. Also, sometimes athletes will just show a decreased interest in practice. Again, it's because they're having pain when they play, but they're just not wanting to complain. So, why is this so important to recognize this? When we have a young athlete that repeatedly complains of pain, and even a period of rest doesn't improve this pain, then it's really important for persistent pain to be evaluated in the office with a physician. So evaluation with an orthopedic surgeon to get the right diagnosis and prevent any permanent injury to a growth plate. We would perform a clinical exam, and we can use x-rays to assess the growth plate. The correct diagnosis can provide the best treatment and help to avoid any unnecessary tests or long-term problems. Again, if these growth plate overuse injuries are ignored, they can lead to fractures through the growth plate or the growth plate to discontinue functioning and close prematurely. Treatment for these overuse injuries. Again, the key is going to be rest. I think you picked that up across all the conditions I mentioned. So sometimes rest does involve a mobilization. So sometimes with their little leaguer's shoulder or elbow, they may have a cast or a sling for a short period of time to help with really truly resting the area if they're having a lot of pain. Sometimes for the lower extremity, we have to use a boot or a brace to help out. Now, as they return, physical therapy may be needed, particularly if they're having persistent pain after a mobilization or need some reconditioning before returning to their sport. It's important to also evaluate and correct any improper form or technique that may be contributing to the overuse injury. So most of these injuries are going to get better with proper rest and therapy. Surgery is rarely needed for these problems when they're caught early. It's really when they're missed and the growth plate goes on to have a potential fracture or stop working that surgery may be necessary. So The key after this period of rest and recovery is this safe return to play. We don't want this to come back again right after they get back to playing. So to ensure the best possible recovery, the athletes, the coaches, and parents all have to be on board with a safe return to play guideline. So an injured player should never return until they have no symptoms. So they should have no pain, no swelling, normal motion, and strength in the extremity. The return to sports should be gradual and with proper form and technique. And if an athlete returns to too much too soon without taking appropriate rest periods or cross-training, then these injuries can return and worsen and continue to plague them season after season. So the growing athlete should also take a break for several months for a year from an individual sport. It's good to remain active during this time, but they can pursue other activities or different positions, different skills, and cross-training during this time. I have included here some resources for parents that you can utilize that are supported by orthopedic surgeons. These are great websites for you to look at. If you have a young athlete, it talks about preventing overuse injuries and reviews the conditions that I just discussed with you. I've included my email here. If you have any questions, please feel free to reach out. Thank you so much for listening in tonight.